can treat the patient, or patient can treat it or not, because patient can just watch, okay? But other patient can need treatment. So first, result of physical examination depend on your clinical examination. Result of laboratory test, specific stage or classification of their disease, their age and general health, their symptoms, if there is symptom or no symptom, and this symptom with complication or without complication, there is previous treatment or not previous treatment, and what is lifestyle of the patient. So either these are depend on the doctor, I mean hematologist, choose the decision for treatment or not. Now, goal for treatment was our goal. First target first, it eradicate evidence of disease, control disease activity, preserving normal performance, quality of the life, and providing lasting relief pain and other disease symptom, and when applicable managing myeloma that is remission over the long term. Now, how to treat the patient with the multiple myeloma? So, go with the general approach for treatment with the patient with the multiple myeloma divided in two parts. So, either treated the patient not fit with transplant, or patient fit with the transplant. Patients that is not fit with the transplant treated with chemotherapy on the melphalan based, or use the new protocols. Patient with autologous transplant, before that we give him induction therapy, and then go with the autologous transplant and continue, if they fail, continue with the induction, and again we can do the second transplant. Now, what are the chemotherapy that use in patient with multiple myeloma? That's two section: old types and the new. Old one, it is dexamethasone and protocol called VAT, that is composed from the vincristine, adriamycin, dexamethasone. And the newly approach or newly types of a treatment is thalidomide, or the new generation of thalidomide, lenalidomide, and Velcade or bortezomib. Now, we focus on the new medicine or new drugs called Velcade or bortezomib. This drug, it is a proteasome inhibitor administered IV with normal saline, and has a few side effects. Most of these side effects, it is neuropathy, especially on the fingers, and thrombocytopenia, and flu-like syndrome in a few patients with the fever, and suspected for the infection, especially zoster reactivation. Now, patient after the treatment with the Velcade or other chemotherapy need maintenance therapy. Now, what are the purpose for maintenance therapy? It is to prolong remission during treatment and give more life expectancy. And also, maintenance therapy required follow-up and monitoring because the toxicity for the treatment. Patient must be have, for the maintenance therapy, must be have disease that is in remission. What is meaning remission? Remission, that means patient present with undetectable or low level of the plasma cells, and patient recovered from all previous toxicities. Maintenance agents must have minimal toxicity, side effect, convenient dosing that use, and convenient route of administration. And the doctor prefer here use IV administration. Okay, so now we're shifting to the other